Good day, everyone. I'm John Allen M. Distao from BSN 1C Group 2, and today I'm going to perform a return demonstration on assessing the peripheral and musculoskeletal system. So, in preparatory phase, first is you're going to assess client's previous medical records if available, so that you can obtain accurate history of the client's thorax and chest, and also to have significant implications in preventing medical errors. The next is you're going to determine the scope of assessment needed and prepare necessary equipment. So it is to gather relevant information why patient seeks medical health care. Then also you're going to perform hand washing and don gloves if deemed necessary. This is to prevent the spread of microorganisms, and by donning gloves, it is where to uh, avoid contact to blood and bodily fluids. So here I have my alcohol-based hand rub, and I'm gonna perform hand hygiene. Next is we're going to assemble equipment and supplies needed. This is for organization of workplace and easy access of the equipment that you will be needing. So here are my equipment. The next is you're going to introduce self and verify the client's identity. This is to ease the client's anxiety, make the client comfortable, and allows you to make a good impression and to ensure the right patient receives the right assessment. So good day, sir. I'm John Allen M. Distao. I'm your student nurse for today, and today we're going to have our assessment. So may I ask your name, sir?
John Mark Pelocotones,
How old are you, sir?
15,
Your birthday?
June 25,
Your religion, sir?
Roman Catholic,
Civil status?
single.
Okay, thank you. The next is you're going to explain the procedure to the client, and explaining the procedure to the client ensures cooperation of the patient. So today, sir, we're going to assess your peripheral and musculoskeletal system, so which is the your upper extremities, your lower extremities as well as your imong spine, sir, ang imong chest, including your legs and feet. Okay.
Okay.
Then next is you're going to position the patient comfortably and provide privacy. So this is to provide comfort and helps build and develop trust. So also the nurse can provide privacy by drawing the curtains. So if you imagine or assume that that we are in the hospital setting, so I'm going to close all the curtains as well as the room doors and windows. The next is moving on to the assessment phase. Let's start at assessing the peripheral perfusion. So in the arms, so first is you're going to observe arm size, venous pattern, coloration, and edema. So arms are bilaterally symmetric with minimal variation in size and shape. So no edema or permanent venous patterning are the normal findings. So now, sir, I'm going to ask you to put your fingers in front, sir. I mean your arm, sir. Iyan na to, sir. And I'm going to observe your arm size, your shape of your arm, any coloration and edema, okay? Okay lang ba sa imo, sir? I-touch ta, magulitan ta ka, sir?
Okay lang na.
Okay. So I'm inspecting for any lesions or any rashes. Your arm size. Okay, ubusa, sir. Next is you're going to palpate the client's fingers, hands, and arms and note the temperature. So, now, sir, I'm going to ask you again to put your arms front, sir. Then I'm going to palpate your fingers. So, okay, your arms are warm. So your arms. I'm going to palpate your arms. Okay. Okay. Then iubos, sir. Next is you're going to palpate to assess capillary refill time and compress the nail bed until it blanches. Then release the pressure and calculate the time it takes for color to return. So I'm going to assess your. I'm going to palpate to assess capillary refill time, sir. I'm going to ask it again. So I'm going to start here. Okay. The color of the blood returns. So your nails is pink, which is normal. Okay. On the other hand, okay. So next is you're going to palpate the radial pulse of the patient by gently pressing that radial artery against the radius, and you're going to note for elasticity and strength. So radial pulse are bilaterally strong, which is 2 plus, and artery walls are holes have a resilient quality, which bounces are the normal findings. So I'm going to check your for your radial pulsar. I want you to spread your arms again in front. So I'm going to check it bilaterally, but first I'm going to check the other hand. Okay. Okay. Okay, I'm checking your heart rate as well as the pulse rate, the rhythm, and the strength of your pulse. So the pulse is symmetric. Then I'm going to then next is you're going to what's that, sir? The next is you're going to check for the ulnar pulse uh, by applying pressure with your first three fingers to the medial aspects of the inner wrist. So the ulnar pulse are not routinely assessed because they are located deeper than the radial pulse. So and are difficult to detect, and so palpate the ulnar arteries if you suspect arterial insufficiency. So next is after that you're going to also palpate the brachial pulse. So by placing the first three fingertips again of each hand at the client's right and left medial antecubital creases. So you can also palpate the brachial pulses if you suspect any arterial insufficiency. So I want you to spread your arms again, sir, in front. So I'm going to check for your ulnar pulse. So iyan na lang sir. So here is your ulnar pulse sa ubos. I'm checking for the pulse rate, the rhythm, and the strength of your pulse. So each pulse is symmetric. Then I'm going to check for your brachial artery. Your brachial pulse. Okay. The next is you're going to perform Allen test. So now, sir, I'm going to perform Allen test. So I want you to squeeze open and then close and repeat. Then squeeze lang din ang imong fingers, imong hands. So sige sir, try ka na sir. Sige, open close. Tapos i-hold. Then i-open. Okay, again. Squeeze, hold. Then on the radial pulse, sige, open. Okay. Then moving on to the legs. First is you're going to ask the client to lie supine. Then you're going to drape the groin area and place a pillow under the patient's head so that you will be able to provide comfort of the patient. So now, sir, I want you to lay down, sir. I want you in a supine position, sir. So, ato ihigda lang, sir. Higda ka, sir. Tapos, sige, sir. Ito ang nasa atong legs. Okay, then I'm going to drape you. Okay. After draping the patient, next is you're going to inspect and palpate for edema and note for veins, tendons, and bony prominences. And if appears symmetric, so use a centimeter tape to measure in 4 different areas, which is the mid thigh, the calf, ankle, and for foot. So identical size and shape bilaterally, no swelling or atrophy are the normal findings. So now, sir, I'm going to